And you are now live.
This is a Senate Appropriations Committee, and we have a bill that has just been referred to us. We should be able to move it out pretty quickly. We have 3 members of the Judiciary Committee who worked on the bill. In addition, the funding that was within the bill for a forensic nurse has actually been, we anticipated and put it in the budget. So the only reason we have the bill is because of that underlying appropriation. But we will review it, although it was talked about at caucus today, but Senator Westman was obviously not a participant at that caucus.
No.
So we're going to give Senator Westman the full load of hay.
Oh, God, I don't need that.
So if you would just give us a quick run through, but Senator Sears is the reporter and he actually did that at caucus today. So Michelle, if you want to sort of give us the high points, and then we will probably move this bill out really quickly.
And do you want me to talk about the whole bill and what the Senate Judiciary strike-all is, or do you want me to talk about the appropriation that was in the House proposal that didn't make it in, or where would you like me to focus? Or just hit all the points?
I just want you to do the highlights as it came out of Senate Judiciary.
Okay.
I think they did some amendments. And the only appropriation I was aware of is for the forensic nurse that we took out and simply took it out of this bill to put in the budget. So it's been funded in the budget.
Right. There was one other in the House bill. There was one other amendment connected to a section that was not included in the Senate Judiciary amendment, and
that carried funding.
Yeah,
Yes.
that's the
council.
That's the Intercollegiate Sexual Violence Prevention Council, and there was a $14,000 appropriation for to the Center for Crime Victim Services to staff it. So they took that out.
I thought it was the network that staffed it.
It's the network that would be staffing it, but in House appropriations, because the network is not a state entity, they wanted it to go through the center. So the money is appropriated to the center and they then pass it along to the network to do the staffing.
Right. Got it.
Right.
So
that's not in there.
All right. So that money isn't in the Senate bill.
No.
not right now, but now because several members of the caucus have expressed concern that it's not in the bill, Senate Education is looking at the bill now.
And what was the funding source? General fund?
Yeah,
I can pop up the language if you want to look at it in anticipation of Senate Ed addressing the issue, or I can come back another time if they move on it or if they recommend including it.
You
don't include it.
Okay, well, what could you just clarify? So Senate Ed, I know, is taking a look at that particular aspect. And was your plan, if they come back and recommend that work go forward, that you would support the appropriation and it would be necessary to fund?
yeah. Yeah, depends on what they come back with.
It was for 7 years.
Yeah,
7.
that's one of the problems. It's a 7-year council.
Yeah.
Well,
14,000 for 7 years?
Yeah.
and I think it's fair to say, regardless of how you view it, the proponents of it in the news stories over the last couple of days describe it as a permanent council. So they're thinking, I'm assuming that in 7 years, we will lift the sunset on it and it will go forward as a permanent fixture, kind of like the pre-K through 16 council, which doesn't have a sunset date.
Okay.
Here's is the standard sunset that they're doing in the House for making sure that kind of committees get reviewed periodically.
Okay. All right, so I'm a little uncertain. The council has been created and has a lifespan right now of 7 years. My question is, the 14,000 that go to the network for training is a one-time funding obligation.
No,
every year.
Well, the appropriation is for FY 20, yes.
but I
only.
think it's intended to continue at
Yeah.
least for 7 years.
Yeah, so it's $100,000 for the life of the bill, I think.
By then, they'll make it permanent,
We
so.
put in the end.
And the training is necessary for all, would they be doing the same training for 7 years in a row?
Would it help if I put the language up? It's not training, it's just, it's basically folks who are working on issues of campus sexual harm, meeting 4 times a year to share best practices and their policies with one another. And so there's not so much a training as kind of a collaborate, like kind of getting all the college folks together to collaborate on what they're all doing and what's working, what's not working, that sort of thing.
Okay, so let me ask, was it the recommendation of Senate Judiciary to strike that section? Or did you take a position on it,
We
or?
took a position to strike that section. Senator Baruth, who works in a college environment.
Well, if I can
Yeah, please.
just explain my take on it. So, I was on the 1-year sexual assault task force that we passed 2 years ago. And that one, if you look at it, had a long detailed page charge of things that we were supposed to do. And we were to complete that work in 6 meetings in 1 year. One of the things about this that I didn't like was their charge seemed very underdeveloped for how long it was going to continue. So it basically, as Michelle said, it asks them to share best practices, meet 4 times a year, and to do sort of, in general, intercollegiate planning on sexual violence, but it doesn't really specify anything. So it's not that I oppose the concept of having this in place. I just think for the length of time they've got it, it's really underdeveloped as it sits. So I was glad to see Senator Sears ask Senator Campion to work on it. My hope is that they come back with a little more meat on what they're actually going to be charged with doing if, in fact, it's to be a permanent council. So if you go, I mentioned the pre-K through 16 council. If you go to the establishing statute for that, again, there's a page of specific things that they're supposed to do every year. There's, kind of deliverables that they're supposed to come up with. And this, it seems like, if it's going to be avoid being a missed opportunity, I just think it should be more detailed what they're going to produce and what they're going to do in that time.
So, 7 years seems like a long time
Yeah.
to create something for the purpose of this exchange. One might think that after you get that structure in place, that this is almost something that can be supported by the institutions. I mean, obviously, they've got a very significant investment in making sure their campuses are safe. We've certainly seen a lot at the University of Vermont. That has certainly been a topic of discussion. And the question really becomes one of the role of the state on an ongoing basis relative to that particular higher education environment, which is sort of a partnership or, some,
What troubles me, and I'll probably get in trouble for saying this, but I don't think anybody questions the problem of sexual violence on college campuses and other places. But I don't think this changes that equation. And I think sometimes people look for silver bullets or simple solutions, and this is not. I mean, that's one of the reasons I did not support keeping it in. It doesn't mean I don't believe there's a problem. I just don't see this as a solution to that problem.
Alice?
This morning on the news, they were talking about the demonstrations at UVM over the weekend. And I heard subsequently, or maybe as a part of that news story, that the administration there had agreed to all of the requests that the students were marching about and would agreed to put them in place. It said they accepted all of them. So, whether that's actually going to really happen or not, I don't know, but it seems like they're solving a lot of their own problems and they don't need this group to get involved. I mean, they have a lot of expertise themselves. So,
Okay, Philip again.
Yeah, I was just going to say that, the House is very, I think, invested and devoted to this bill. So we're going to wind up having this discussion, whether the Education Committee goes along with the Judiciary Committee, or whether they go along with the House, or whether they do some kind of extra work and we pass it that way. We're going to have this discussion with them anyway. And so my hope is that by the time we reach the end point, if we pass a version of this panel, which I'm not against, I just want it to be more effectively designed than I think it stands current. And I think we're liable to get that if we conference with them on it. I think that would be the outcome.
I'm just trying to, for those of us who are trying to sort this out for the very first time, and I think there's no question that this is a serious issue. I think this whole discussion raises what is the responsibility of the state, I mean, in terms of state government relative to, because many of some of the colleges, of course, are publicly funded, but many are not. They're private institutions and all have an obligation to protect and make sure that they have a safe learning environment for students. And so how we want to proceed on this is, I think, what we're attempting to sort out. If I've got it correctly, you've asked the Education Committee to make recommendations. We funded the forensic nurse, recognizing that was an important area of support. And we've already put it in the budget. $12,000 to help facilitate the meetings or the work, which is still a bit undefined, would be about $12,000.
Yep.
But which we will, for small amounts in separate bills, we can find that amount of money. So my question becomes one of what does this committee, it seems like this committee at this point, we can move the bill out favorably as we've got it, knowing that education may come back with an amendment, but there is no, at this point, there is
Money spent.
no funding decision to be made. If the Senate Ed wants to support this work, then when they do their amendment, they'll have to put the funding of $12,000 in it, and we will. My view is that we would support that funding. Senator Baruth.
And I'll defer obviously to both chairs of Judiciary and Approps. I worry that if we move this out as the Judiciary put it in, then people will mistakenly they won't understand that education is still looking at it. They'll see that the boo.
Then
that
we
the bill
don't need to act on it today. Is that?
That was
what
my
you're- Okay.
point. Yeah.
Okay. All right, Senator Westman, you wanted to make a comment?
Well, I read the bill and so it's the sentencing commission that would get the 12,000 or?
No. Sentencing Commission is just looking at lewd and lascivious. It's a different act and it's prosecuted in a different way. Michelle can really explain it best.
Okay.
So
Okay.
we were questioning how that gets prosecuted under this new bill, under the new consent statutes.
Okay,
And so that's the Sentencing Commission won't cost a dime for us to have that look at that.
okay.
But
So what you have
Michelle can
here,
explain the difference there.
all right,
Okay.
we'll let Michelle just do a run through and the highlights.
That would
I
be
think we've got
helpful.
two funding things, one of which we've already dealt with, and that was the forensic nurse. And
Yeah,
the other is depending on the recommendation of education, and we'll just hold the bill until they've had a chance to do this. And that is whether we would appropriate the 12,000 or whatever to support that work, depending on what we have for a recommendation. Alice?
And just to make sure you know this, it's not a forensic nurse, it's a nursing program. It's nursing, to train nurses to
Yeah,
work,
all right. Yes, okay, sorry. Yeah.
plural.
Yeah, all right. Forensic nurses, which is really an important expertise to have. There's no question about that. So Michelle, do you want to just run through the highlights? But I think at this point, we're going to hold the bill. We'll wait for what education wants to do. And if it requires the funding that was recommended in the bill as it was passed by the House, we will deal with it once we have the benefit of knowing what their recommendation is. And so, Michelle, if you want to just give us the highlights. Senator Sears did do it for some of us at caucus, but it won't do any harm to go through it again.
Okay, and so rather than walk through section by section, just give you a little broad overview.
That would be great.
Sure. So, so I'm talking about the Senate Judiciary Strike-All Amendment, and the first three sections of the bill are addressing Chapter 72 in Title 13, which is your sexual assault chapter, and it's updating the laws with regard to consent to sexual conduct. Our laws around consent were adopted in 1977 when Chapter 72 was established, and they haven't really been updated at all since then. We've made a lot of changes to the sex crimes that are in statute, but around the issue of what constitutes consent, who can consent, under what conditions can they consent, that really hasn't been addressed since it was enacted in the 70s. And so there's three sections where it's addressed. For the first being the definition section. There's two new definitions in the sense that the current definition of consent, there's new language added. It's based on the Oklahoma's definition of what they use. There's also a definition of incapable of consenting, and that's taken from federal law. Section 2 has to do with the elements of sexual assault. And I would say the biggest change there is clarifying that if someone is substantially impaired by alcohol, drugs, or other intoxicants, it does not matter whether or not they actually ingested those intoxicants willingly themselves, or if somebody else secretly gave them to them. And so you might have heard about that case in Minnesota and the Minnesota Supreme Court decision a few weeks ago, where under their scheme, which is similar to ours, but we have a couple saving graces that keeps us from that analysis. But Minnesota came down and said that their statutory scheme didn't support it if you actually were the one who drank yourself. It only was if somebody else drugged you. And so we've just clarified some language in there to make sure we wouldn't get any kind of decision like that. And then Section 3 builds out kind of more details around the issue of consent, such as a sleeping or unconscious person is incapable of consenting, that type of language. And that relates to the new section 4 that's the judiciary added with regard to asking the Sentencing Commission to look at this issue of consent as applied to lewd and lascivious conduct. So lewd and lascivious conduct is in another chapter. It's not in sexual assault, and it has been kind of the catch-all felony offense for all types of behavior, everything from someone exposing themselves to unwanted touching, things like that. And a few years ago, the legislature, I think in 2017, established a new essentially misdemeanor offense under LNL. So it's now called prohibited conduct. And so those types of offenses, so now instead of LNL being this super broad category and kind of catch-all, LNL is typically used to address when there is unwanted sexual contact. So maybe like a groping or something like that. And then the prohibited conduct tends to be more things like flashing or a couple having sex in public or things like that. And so it begs the question that under 13 VSA 3254, which is in the sexual assault chapter, it also applies the consent structure to LNL. Now that there's two different LNL crimes, essentially, is it still important for those consent provisions to apply to 2601? Should they also apply to 2601A or not? Things like that. So the Sentencing Commission is going to take a look at that and then let you know whether or not they think there should be any updates to that. Section 5 is data collection and reporting. And this is to address the issue of kind of like what happens from the point of when there are reports of sexual assault down to, what is disposition of cases that are actually brought. So I think, I think generally the data shows that sexual violence is unreported. So you take the number of cases that are actually reported to law enforcement, and then you distill that down and you say, well, out of the, however many cases were reported to law enforcement, how many did law enforcement refer to prosecutors? Then out of those numbers, how many cases did then prosecutors take forward and bring charges? And then out of those that brought charges, how many resulted in, what was the disposition of those particular cases? So this is essentially asking the Department of Public Safety and the Vermont, using data from the National Incident-Based Reporting System, as well as the Vermont Judiciary, to collect that data. This has no cost. The data is there and they're able to do that, was their testimony, to collect that data and to organize it by county, and then to report to the General Assembly on or before September 1st, 2024, and then biannually after that. And then they're also supposed to make that information available on their website in a way that the public can access it and easily kind of navigate that information. And then in the judiciary strike all, then it goes to the effective date. I just will mention the stuff that is in the appropriations for the House proposal. You had mentioned the forensic nursing program, and that is, as Senator Nickham mentioned, that is for the existing program and doing a pilot to expand their services into more rural communities that where folks are far from an ER, because right now the forensic nursing program that has to be done through an emergency room at a hospital. And obviously there's big swaths of the state where, you have a victim and they would have to drive quite a ways to be able to access those services. And so the $40,000 that you have now in the budget is to expand that and to look at whether or not you can provide those services in primary care settings as well as reproductive health care settings. And then with regard to the other appropriation, the way that House appropriation structured it would be $11,990 for staffing the intercollegiate council, and then there's $1,010 appropriated for per diems and expenses. I think there's just a couple folks on that council who might not otherwise be being paid to attend those meetings. And And so we'll see what Senate Ed recommends tomorrow on that.
Thank you, Michelle. We've kind of bounced around, but it's good to get a total run through of the different sections. Other questions? Okay. On the expansion of the forensic nursing expertise, is that done through a nursing program? Is it through the Vermont State College system or through UVM nursing, or how is that being provided?
You would,
Envisioned?
the network can talk to you about that and how, because they are the ones that run the program.
I see. Okay. No, I don't, I was just wondering.
Oh, okay, sorry.
If it, how it would be delivered, but I guess that you're relying on the network. Okay.
My recollection was there was a discussion about having it in doctor's offices and so on.
Yeah.
So that, for example, I don't know what's available for an emergency room at Linden or in Johnson. So, maybe a place they could go directly, or maybe there's a nurse at the college. I don't know.
No, I was just wondering who was doing the training. I
believe it's, they have trainers.
Yeah. Okay.
So the bill will sit with us, but Brian's gonna look at it unofficially, or?
Unofficially tomorrow. By Thursday, I believe he said he could look at it.
Yep.
Mhm.
He didn't say whether in the morning or the afternoon, so I'm not clear what
Oh,
time. But
okay.
he said he'd look at it. I'm, hopefully Senator Baruth will have a conversation.
All right. Well, we have three.
I don't know how many other members are left that were on that other council.
Oh, the one that Senator Baruth referenced?
Oh, it was Representative Colburn for the House and me for the Senate.
Was the second person?
Representative Colburn
Yes, and you?
and me.
It was Chittenden-centric, Alice.
Any other questions or of Michelle while we have her? Otherwise, I'm sure she has other things and listening to us trying to put together the pieces here as we've kind of moved all around. Thank you, Michelle. As you can see, you have 3 members of judiciary, so the rest of us are kind of, coming to this discussion a little later and not the same amount of information. So it's been helpful. Thank you.
Sure.
Because obviously this is campus safety is really a critical issue. So I am going to suggest then we'll just do what we said. We'll hold and we'll wait until what education decides, and then we will deal with the 12,000 appropriation at that point.
Yep.
Okay, thank you. Thank you, Michelle.
Thank you.
Chrissy, I believe that's all we have. Is that correct?
That is correct. That's all we have for today.
Okay. So, and I'm going to then, it's 2:05. I'm going to adjourn the committee for today. We're kind of on as needed basis until we get other bills, and we will be starting up conferencing at some point soon on the budget. Stephanie has been over briefing the House Appropriations Committee on what was in the Senate bill so that they're familiar with the changes that we made. So I'm going to adjourn